Hello, my name is Jacob. Today I'm going to be doing my indwelling catheter skills video using my GPSPs. First I would knock, enter the room, identify myself to the patient. Hello, my name is Jacob. I'm going to do a catheter on you. Is that okay? Patient gave me permission, so I'm going there. First I'm going to get my two patient identifiers. Everything matches there, so we're good there. I'm going to do a pain assessment. The patient states that they're in no pain, so I'm good there. If they were, I would use my 11 rights and 3 checks to administer pain meds off of their MAR. I'm also going to assess my patient for any allergies. The patient states that they have no known drug allergies, so we're good there. I'm going to make sure that my patient's in a comfortable position and go ahead and place the waterproof pad down, perform hand hygiene, don clean gloves, and perform pericare. Grab a wipe, start on this side, going top to bottom. Grab another wipe on this side, top to bottom, dispose. New wipe down the middle, top to bottom, dispose. At this point, I can go ahead and remove my gloves, perform hand hygiene, and set up my sterile field.
Yeah, I was gonna do nothing late, so.
At this point, I can go ahead and perform hand hygiene and put on my sterile field. Take a step back. Okay. At this point, I can go ahead and set up my sterile field. Take my lube, squirt over here in the corner, dispose of it, and then I'm going to take my syringe and attach it to the port, and then I'm going to go ahead and take the sheath off. Disposing of it. And then put catheter back in the box, sitting it in the lube, and then I'm going to sacrifice this hand, spreading open the labia, exposing the urinary meatus, and then I'm going to take this hand, getting my swabs, cleaning the farthest side away from me first, exposing the bit, getting the next swab, cleaning the closest side to me, disposing of it, cleaning the next swab, cleaning down the middle, disposing of it, and then I can dispose of its package. At this point, I'm going to go ahead and get my catheter, make sure that it's lubed up, and I'm going to tell my patient to take a deep breath. I'm going to go ahead and insert it, making sure to never let go. Once I get urine return, I'm going to insert another 2 to 3 inches. Once I get where I need to be, I'm going to take my sacrificed hand and hold it in place, and then inflate the balloon with 5 cc's of water, or with saline. Once I have that, I can disconnect my syringe and dispose of it. I'm then going to perform the tuck test, and it's in place. I'm then going to secure it to my patient's leg. I'm then going to take my bag, make sure that there's no kinks in the tubing, make sure it's hung below the level of the bladder, it's hung on a non-movable part of the bed frame, make sure that there's no backflow, and we're all good there. I'm then going to clean up my supplies. I'm going to make sure that my patient is in a comfortable position, cover them up, make sure that their call light's within reach, come back and reassess within 30 minutes, go ahead and remove my gloves, report and record.